If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, why is diabetes so bad? Answer by Svetomir Georgiev. Diabetes mellitus, DM, commonly referred to as diabetes, is a group of metabolic diseases in which there are high blood sugar levels over a prolonged period. Symptoms of high blood sugar include frequent urination, increased thirst, and increased hunger. If left untreated, diabetes can cause many complications. Acute complications can include diabetic ketoacidosis, non-ketotic hyperosmolar coma, or death. Serious long-term complications include heart disease, stroke, chronic kidney failure, foot ulcers, and damage to the eyes. Diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. There are three main types of diabetes mellitus. All forms of diabetes increase the risk of long-term complications. These typically develop after many years, 1020, but may be the first symptom in those who have otherwise not received a diagnosis before that time. The major long-term complications relate to damaged blood vessels. Diabetes doubles the risk of cardiovascular disease, and about 75% of deaths in diabetics are due to coronary artery disease. Other macrovascular diseases are stroke and peripheral vascular disease. The primary complications of diabetes due to damage in small blood vessels include damage to the eyes, kidneys, and nerves. Damage to the eyes, known as diabetic retinopathy, is caused by damage to the blood vessels in the retina of the eye, and can result in gradual vision loss and blindness. Damage to the kidneys, known as diabetic nephropathy, can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease, sometimes requiring dialysis or kidney transplant. Damage to the nerves of the body, known as diabetic neuropathy, is the most common complication of diabetes. The symptoms can include numbness, tingling, pain, and altered pain sensation, which can lead to damage to the skin. To oversimplify things, diabetes is no way near good for you. There are way too many complications that arise with this condition, and let's not mention the insulin intake process, and the fact that you always have to be 100% aware of what you eat, drink, and what are your blood glucose levels. Answer by Leanne Heising. I'll answer from a doc's perspective, having been a pre-diabetic for many years, a few years a type 2 diabetic not on meds, after losing weight and more exercise back to being a pre-diabetic again. Diabetes is much more than just an elevated blood sugar. It involves one's whole body. It can and often does lead to serious complications. Even in well-controlled diabetes, middle-aged diabetics people have a much higher rate of having a myocardial infarctions, as if they already had one before, aka risk equivalent. This is why all middle-aged diabetics are prescribed a statin, even when having normal serum lipids. This has been proven to lower the risk for a myocardial infarction by 25%, not to the level of non-diabetics. In diabetics, strict blood pressure control less than 130/80ths of a millimeter. Hg is needed so not to develop diabetic kidney disease, the number one reason for end-stage kidney failure. Strict blood sugar control will largely prevent diabetic retinopathy/eye disease from developing, of not regularly checked for, and if needed treated will lead to calamitous blindness. Strict blood sugar control also will lower the risk for nerve damage. Diabetic polyneuropathy, which usually causes a terrible burning pain in the legs, sometimes arms, loss of gnostic, feeling how a limb/finger is positioned, feeling, leading to loss of balance and falls, in more severe cases loss of muscle strength, even leading to paralysis of the stomach, vomiting, thus risking low blood sugars, and or treatment-resistant constipation. Autonomic neuropathy, a lower HbA1c, reflecting an overall better diabetes regulation. In the middle-aged, but especially in the elderly, a HbA1c of less than 6% correlates with more deaths, probably because of more unfelt, e.g., nightly, low blood sugar episodes in people having coronary heart disease causing arrhythmias and death. To see more graphs, please see if I am diabetic. My A1C is 6.0 to 6.7. Is my current diet enough? If my A1C is in the target range, is any further reduction in my diet called for? Do I have to cut out all desserts and candy?